Hi, I'm reading case study 3. So case study 13-1, total abdominal hysterectomy with bilateral salpingal oophorectomy. MT, a 60-year-old gravida para 2, had spent 3 months under the care of her gynecologist for treatment of postmenopausal bleeding and cervical dysplasia. She had had several vaginal exams with pap smears, a uterine ultrasound, colposcopy with endocervical biopsies, and a DNC with cone biopsy. She wanted to take hormone therapy, but her doctor thought she was too much at risk with the abnormal cells on her cervix and the excessive bleeding. She had a TAH and BSO under general anesthesia with no complications and an uneventful recovery. Her uterus had been prolapsed on abdominal examination, but there was no sign of malignancy or PID. The pathology report revealed several leiomyomas of the uterus and stenosis of the right oviduct. She was discharged on the second postoperative day with few activity restrictions. Case study 13-2, in vitro fertilization. CA had worked as a technologist in the IVF lab at University Medical Center for 4 years. Her department was the Advanced Reproductive Technology program. Although her work was primarily in the laboratory, she followed up each patient through all 5 phases of the IVF and embryo transfer treatment cycle: follicular development, aspiration of the pre-ovulatory follicles, sperm preparation, IVF, and embryo transfer. Her department does both GIFT, gamete intrafallopian transfer, and ZIFT, zygote intrafallopian transfer procedures. While the female patient is in surgery having an ultrasound-guided transvaginal oocyte retrieval, CA examines the recently donated sperm for motility and quantity. She prepares to inoculate the sample into the cytoplasm of the ova as soon as she receives the cells from the OR. After inoculation, she places a sterile petri dish with the fertilized oocytes into an incubator until they are ready to be introduced into the female patient. And case study 13-3, cesarean section birth. AY, a gravida 2 para 1 at 39 weeks gestation, had been in active labor for several hours, fully effaced and dilated, yet unable to progress. She has had an uneventful pregnancy with good health, moderate weight gain, good fetal heart sounds, and no signs or symptoms of pregnancy-induced hypertension. X-ray pelvimetry revealed CPD with fetus in the right occiput superior position. Changes in fetal heart rate indicated fetal distress. AY was transported to the OR for emergency C-section under spinal anesthesia. After being placed in the supine position, AY had a urethral catheter inserted and her abdomen was prepped with antimicrobial solution. After draping, a transverse suprapubic incision was made. Dissection was continued through the muscle layers to the uterus, with care not to nick the bladder. The uterus was incised through the lower segment, 2 centimeters from the bladder. The fetal head was gently elevated through the incision, while the assistant put gentle pressure on the fundus. The baby's mouth and nose were suctioned with a bulb syringe, and the umbilical cord was clamped and cut. The baby was handed off to an attending pediatrician and OB nurse and placed in a radiant neonate warmer bed. The APGAR score was 9 out of 9. The placenta was gently delivered from the uterus, and the scrub nurse checked for 3 vessels and filled 2 sterile test tubes with cord blood for lab analysis. AY was given an injection of Pitocin to stimulate uterine contraction. The uterus and abdomen were closed, and AY was transported to the PACU, post-anesthesia care unit. Number 1, MT is a gravida 2 para 2. This means B. She has had 2 pregnancies and 2 births. An endocervical biopsy is D, a tissue sample from the lining of the cervix. A curettage is an B, scraping. 4, a colposcopy is an endoscopic examination of a vagina. Another name for a leiomyoma is a B, uterine fibroid. 6, pregnancy-induced hypertension is also called D, preeclampsia. 7, the occiput of the fetus is C, back of the head. 8, Pitocin is the trade name for oxytocin. 9, I got prolapsed. 10, I got zygote. 11, I got pelvimetry. 12, I got fundus. 13, I got Apgar test. And 14, I got postpartum. 15, DNC, dilation and curettage. 16, BSO, bilateral salpingo-oophorectomy. 17, PID, pelvic inflammatory disease. 18, HRT, hormone replacement therapy. 19, IVF, in vitro fertilization. 20, CPD, cephalopelvic disproportion. 21, OB, obstetrician. 22, I think it's supposed to be GYN, so I put gynecologist. 23, GU, genitourinary. Thank you.